My name is Angie Hotz, and I'm a student midwife. And for my biology 1050, my anatomy and physiology class, we are asked to demonstrate clinical pelvimetry with a pelvis model. So the importance of clinical pelvimetry, there are a couple of different things that are fascinating and I think are of great importance. I think it's a really useful skill to have. I don't know that it will be something that I will do regularly with every client. I don't really think that that's going to be necessary. I'm assuming that most pelvises are adequate to let a baby pass through them. However, what if the baby isn't coming? Then being able to have that skill to assess whether or not the size and shape of the pelvis is or is not a factor, I think that's important. So on the flip side of that, what if a client, what if a woman or a pregnant birthing person is nervous about the adequacy of their pelvis? I would like to be able to reassure them that through that assessment and feeling of the bony pelvis, then I can assure them that the size and the shape seems to be adequate. And then again, that the pelvis is influenced by hormones that make it more mobile. So the relaxin is going to soften up this cartilaginous joint, the pubic symphysis here in the middle, like that is, hormones affect that and soften it up. And also those same hormones affect the sacrum and the tailbone, the coccyx as well. So being able to reassure them that the pelvis is mobile and through movement and the hormones that are influencing that, the size and the shape is not the only thing to consider. But being able to assess the size and the shape is important. It is a tool in the toolbox. So to go ahead and begin and walk through the process of clinical pelvimetry, to start with, we would insert 2 fingers into the vagina and have the thumb on the outside of the perineum and 2 fingers on the inside. We're going to palpate the transverse perineal muscle. And we're going to assess the density and elasticity of that muscle. So then we're going to feel the coccyx and palpate that and assess the mobility of it. Normally it would be mobile. So then we're going to feel the sacrum with the fingers. I can get my pelvis here. Then we're going to feel the sacrum with the fingers and we're going to move front to back and side to side. And we're assessing the shape and the length of the sacrum. It's normally concave. And then we're going to palpate the promontory. So we're going to find this sacral promontory. And some people look for that, and that alone is part of the assessment of this diagonal conjugate. Whether or not they can feel it, it's said that if you can't find it and can't feel it, that's a good indicator that the pelvic outlet is adequate. So you would hold the tip of the middle finger on that sacral prominency, and then have the hand here where right before the thumb, and then we would assess and measure that distance. So it's a good idea, which I did just do a little while ago. I measured the tip of my middle finger over to right before the thumb without pushing in, and mine is 13.5 centimeters. I actually have really long, skinny fingers. I'm not a piano player, but I'm a midwife, so, which is kind of funny. I've had other midwives laugh at that. And I also measured the distance here of my 4 knuckles when we measure in a little bit the distance between the ischial tuberosities. Mine was 9 centimeters. So those are things that you want to know in order to assess that distance. So back to the sacral prominency and the pubic arch, we would be assessing that distance for the diagonal conjugate. So after that, we're going to trace the pelvic brim. Only if the head is floating high in the pelvis are we going to be checking for the diagonal conjugate. And also, it's going to be hard to feel that brim if the head is low in the pelvis. So the head needs to be floating really high in order to do this. So we can also at this point palpate fetal fontanelles and sutures. So we're going to feel the pelvic brim and see if it's angulated or if it's rounded. It should be rounded, and we should only be able to go about halfway around with the fingers. So after that, we're going to pass the fingers down. Let me see if I can see this right. We're going to pass the fingers downward from the brim along the pelvic, the side of the pelvic walls, to determine if the side walls are straight, convergent, or divergent. And then we're going to palpate from the brim down to the ischial spines. So ischial spines, these bony prominences that stick out here, and we're going to be looking to see if they are blunt, if they're blunt and harder to find, or prominent or very prominent and sticking out a lot. We want to assess that. So then we're going to be looking at the sacral and palpating the sacral sciatic notch. So we would be putting our two fingers across here and feeling this distance here. Noting whether it's narrow and deep or wide and shallow. And then we're going to palpate the inner spinous diameter. So two fingers, and whether or not those two fingers can feel both of the ischial spines at the same time. It's assumed that most of the time you're not going to be able to feel both of those at the same time. So after that, we would withdraw the fingers, make a fist, and feel with the fist in between the ischial tuberosities, these things right here that stick out, and feeling whether or not that fist can fit in between those ischial tuberosities. So the last thing to do is feel for the subpubic angle. So the angle of this pubic arch right here. It's a little bit hard to do with the pelvis, but we would take our thumbs and just push the thumbs on either side of this pubic arch. And then we're going to measure and note this angle here. So this angle of this pubic arch, we're going to note the angle of that, of the thumb along the inferior pubic ramus. So, and then we're going to estimate the angle at which they meet. In a gynecoid pelvis, in a normal subpubic angle, it's 85 to 90 degrees here. Okay, I think that is the conclusion of walking through clinical pelvimetry. Thank you so much for watching. I hope you enjoyed it.